Hey y'all, it's Allison. Welcome back to my channel. Today we are going to talk about part 2 of the potty training series that I started a couple weeks ago. Today we're going to dive into more about what we did to get Ashton where she is now with potty training, which is not perfect by any means, but we are so close and she's doing so amazing, and we would not have been able to do it without this process at all. It's called Intensive Toileting Protocol. And actually at the end of this video, I'm going to have a link where I actually have a PDF of this, what we go through in this video. It's actually like very detailed step-by-step of how you can implement this with your kiddo. So stay tuned to the end so you can download it on that end screen, and it's all yours. It was actually written for Ashton specifically at Blue Sprig, where she goes to school. And so it is amazing. It works if you follow it. It's pretty, it's pretty stringent, and for some kids, of course, it'll be harder than with others, but that's it. So we'll just kind of dive in.
Good.
You all done? Okay.
Yeah.
All done? Okay. All right, can you pull up your panties? Pull them up. Oh, good job. Don't forget about the back. Can you get the back? Hey, what about the back? Make sure you stay tuned all the way to the end of this video, where you'll be able to download a PDF document that was put together specifically for Ashton for her toilet training by AB. Okay, so what is intensive toileting protocol? So here are the components of it, and then we'll kind of go into it more. But it has a very strict sitting on the toilet, and then versus being away from the toilet schedule that you can follow all throughout the day. You'll want to start and have no other distractions throughout the day. You will be dedicated to this, say, 8 a.m. until 4 p.m. So it's very intensive. They did it for us and continue to do it for us at Blue Sprig, which we're so grateful for. And then we continue it at home, but they do it. This is what they follow all day, every day while she's at school. It involves them just, wearing their undies. So, no pull-ups, or you put the pull-ups out the door. You can use them for nap time and nighttime only, and the rest of the day you are in undies. You get consequences and rewards in this program for successes and failures. They increase your fluid intake. They increase the fluid intake so that you have more opportunities for the kiddos to go to the bathroom. So then they know what happens when they go, whether it's good or bad, and allows them to learn more quickly because you're giving them more opportunities to go to the bathroom. It teaches a lot about communication within the protocol itself, and the use of positive practices for accidents. Step 1 of this process is picking what your child's reward is going to be for their successes. This has to be something that they are willing to do anything for, like gold. So for Ashton, it is her dangle toys. It was a certain string that she had that she liked to dangle. One of her, something that she stems with. For a lot of kiddos, it's, a piece of candy or, a chip or whatever their favorite snack is. Ashton wasn't motivated that way, but sometimes time with the iPad, time with a certain toy or their blanket or something like that. So you want to find what that one item is and set that aside just for toilet training. So when Ashton, her preferred dangle at the time was like this string, this lace card with the string on it. She only got to use that when she was toilet training and when she had successes. So no other time. So she associated that toy with her successes in the potty. So pick what that reward is, and it could change, like with Ashton, it kind of every couple of weeks she would, change her preference of toys she liked. So, it can evolve, but it just has to be whatever is at the top tier of what they are willing to work for, because that is key to the success of this program. Okay, step 2, gather all the supplies you're going to need and figure out the environment where you're going to be. Since you're going to be going back and forth so much to the potty in the beginning, it's nice to be set up. Some people will set up like right outside of the bathroom or in the room next to the bathroom, whatever is easiest for you. But I show in the video that our setup, you want to have plenty of clean undies, plenty of change of clothes. You'll want to have toys set up so when there's toys or books, I put a little table next to the toilet where they can have books and stuff to look through, because sometimes they'll be sitting on the potty for up to 15 minutes, and so you want to have stuff for them to do while they're in the potty, or they can have like an iPad on. And then whatever their favorite drink is, just have it like all you can drink buffet all day. So for Ashton, it was apple juice. Like we just diluted apple juice and they had a cup for her all day, and she was just able to drink and drink. And she luckily, she likes to drink apple juice. And so she had plenty of opportunities to go to the bathroom. Make sure you have their reward ready that they're going to be working for, the item that they want to work for. And then I would get out, keep a journal of, maybe print out a graph or a chart where you can write down all the times and what happened at each time you went into the restroom, so you can kind of keep track of their results. Okay, so here we are. It's day one. You're ready to get started. So here's what you're going to do. You will start by just setting up your play area and offering them their drink. And as soon as they take that first drink, set a timer. You're going to want to, have a timer on your phone. Sometimes it's better to have a separate timer than your phone, just because, I don't know, it's just easier. So 30 minutes after their first drink, you're going to take them to the restroom and have them sit on the potty. And with Ashton, we said, push the TT out, push the TT out, and, talk to him and tell him to go potty, whatever the words you want to use are, and just keep encouraging them to do that and stay on the potty. Okay, so after 10 minutes, so set a timer, and then after 10 minutes, if your kiddo has not gone to the bathroom, then that's okay. You finish the process, have them pull up their pants, pull up their undies, and then you go back to your activity that you were doing. If they did go potty, oh my gosh, you get so excited and praise them, and you give them their reinforcement. You let them know, hey, good job. You went potty, here's your dangle, or here's your iPad, or if it's a food, whatever it is. If it's an activity, like with Ashton, it was a dangle, so she would get 1 minute with her dangle. So we would set the timer, and she'd get 30 seconds to run around the room and do whatever she wanted to do. And then once the timer went off, we took it back from her, and then you continue on with your activity. So then you will follow, at the end of the video, I give you an actual schedule that'll tell you, like by the minute that first day, how long you will stay before coming back to the toilet and this and that. So download that at the end, and then Okay, so quick summary of that first step. From the first time your kiddo takes a drink in that first morning, you'll set the timer for 30 minutes. Once the 30 minutes timer goes off, you'll go into the potty, have them sit on the potty. If they don't do anything, let them sit there for about 10 minutes. After 10 minutes is over, if they haven't gone, you just tell them, okay, we'll go next time, and have them get off the toilet and go back to what you're doing. If they did, you praise and go crazy and go nuts, and you give them their reinforcer, and you allow them to, if it's an activity, give them that minute with it. And if it's a snack or a food, let them finish that, and then you move back into your routine, and you'll follow the protocol, you'll follow the schedule that I link at the end of the video. Okay, so here's the part of it that's a little bit confusing. So I'm just gonna kind of do a broad overview, and then you'll have it to download so you can look over it yourself, and always feel free to email me or message me with any questions. But there's 16 different levels, and the chart shows you exactly what to do. And let's see, so on day one, you will increase by 1 level for every 3 consecutive successes in the potty. And then on day 2 and 3, you will increase by 1 level after 4 consecutive successful voids in the potty. And on day 4, you'll increase 1 level every 2 days. So Ashton, it took her probably, I think, about 2 months to get through all the levels. So it can be a really long process. Some kiddos can get this in 3 days, I've been told. So again, Ashton has autism and Down syndrome. So it's a little bit, every kid is different. So it took longer for us. And so anyways, you can follow this schedule if you follow this closely. I truly think it works. I think it's amazing. Okay, so the big question is, what do you do when they have an accident? Because, of course, they're going to a lot. So for the phrase they use is no wet pants. So we say that a lot around our house. And Ashton absolutely knows what it means now, especially when we're in the car and we're with, in the big girl panties. I'm like, no wet pants, Ashton. I remind her through the whole ride. And usually she will always listen. So if you are, say you're in the other room and you have the accident, you say no wet pants. To take them directly into the bathroom, prompt them to pull down their pants and get on the potty. This is the part that comes in where you want to make this a negative consequence so that they don't want to do it again. So you have them go in the potty, sit on the potty, and then if they don't go, have them get out, pull their pants back up, and then you're going to start all over. And you say, when we go potty, we come into the bathroom. And so you have them take down again. They'll still have their wet pants. Pull their wet pants down, sit them on the potty, and make them sit there for 1 minute. And then do that exercise 3 more times for a total of 4 times. Ashton got really mad when we did that. She does not like it. They're not going to like it probably, but you just try to ignore that problem behavior and just work through the practice. So I know I did not explain this perfectly because it's a really difficult subject. It's a difficult subject to teach some kiddos. It's been challenging for us with Ashton. So I'm not claiming to know any of the right answers. I'm just sharing with you what's worked for us. And with Ashton, we struggled for her to tell us she didn't tell us when she needed to go to the bathroom. So at Blue Sprig, we were introduced to, we use ProLoQ, which is an app that you use on an iPad, and it's a communication app. So there's a potty button on there. So when Ashton is at school, she has her device with her all the time, and then also when she's at home. And so when she has to go potty, she'll push the button and it'll say potty, and we'll take her. And then, she gets a reinforcement, she gets a reward. And so a lot of the time she will do that at school. We haven't gotten her yet to where she'll just walk into the bathroom when she's ready. That's something we're still working on. But you will learn what your kiddos' cues are, and hopefully they pick it up really quickly. And you only have to do this for a couple days. We've been at it for a while, but we're getting progress with it, and so we're excited about it. And like I said, I'm going to give you the link at the end. You can download it, and then I'll have my email in the comments or in the section below. And if you have any questions or any feedback, I would love to hear those. I would definitely love to hear any comments that you have or anything that's worked for you, or if there's anything that I left out that you think would be helpful for other parents. Please let me know, and I can put that into another video possibly, or send out that info.